Hello and welcome to our show, Health and Wellness Myths and Facts. I'm Ankita Mukherjee. The endocrine system is a network of glands that produce and release hormones. These are the hormones that are responsible for various functions in the body, from heartbeat to tissue growth to even the creation of new life. Diabetes mellitus is one of the most common endocrine disorders that affect the body's ability to produce or use insulin. And worldwide, 537 million adults currently live with diabetes. The number of people with diabetes in India is the second highest in the world. 74 million adults who live with diabetes in India. Now, those are really shocking numbers. The worst part of this is that diabetes in India starts at a relatively young age, almost a decade earlier than in Western countries. Early onset diabetes increases the risk of associated complications. And what can we do to guard against this? Well, educating ourselves and making sure there's better management and control of diabetes, of course, is one way to go about that. There are several misconceptions also about diabetes prevention and management, and it's only by making ourselves aware that we can help everyone else understand just what we live with. This is exactly what we hope to do in this program. Our experts provide medically accurate and actionable advice on both preventing diabetes and helping identify strategies for long-term control of diabetes. Joining us today, Dr. Parthapratim Chakraborty, Assistant Professor, Department of Endocrinology and Metabolism, Medical College, Kolkata. Dr. Professor Sunil K. Pal, Senior Consultant Endocrinologist with Divine Nursing Home, Suraksha Clinic, Kolkata. And Dr. Sunil Kumar Kota, who's a Consultant Endocrinologist, Diabetes and Endocare Clinic in BERHAMPUR. Thank you all for being with us. Let me begin with Dr. Chakraborty first as well. Dr. Kota, how does birth weight affect the risk of developing type 2 diabetes mellitus?
Ankita ji, it indeed is an interesting and intriguing situation as well, because the birth weight is having a U-shaped relationship with onset of diabetes in later life. Studies tell us that low birth weight, which is defined as birth weight of less than 2.5 kg, is associated with 22% increased risk of diabetes. On the other hand, high birth weight, which is defined as a birth weight of more than 4 kgs, is also associated with 19% increase in occurrence of late onset diabetes. You can see the high birth weight is an indicator of uncontrolled, undiagnosed or untreated diabetes or obesity in the mother, and this high weight can induce a state of insulin resistance, whereby the body's insulin will not be able to discharge its normal duties of controlling the sugar. On the other hand, the low birth weight, as proposed by this Barker hypothesis, is an indicator of intrauterine undernutrition. This gives rise to defective programming of the neurohormonal circuits, which are present in an organ of brain called hypothalamus, essential for appetite, body weight and metabolic control. If you see a low birth weight baby is subsequently subjected to neonatal overfeeding, that can give rise to diabetes and obesogenicity. So the public health importance is that if a baby is born low birth weight or high birth weight, in either case, you have to ensure that the baby is not getting affected with unhealthy diet, physical inactivity and unfavorable body composition.
Right. Thanks very much for that. That was very clarifying. Dr. Chakraborty, Dr. Kota, can early short-term insulin treatment in people who've recently been detected with diabetes actually help to reverse type 2 diabetes, or is this completely irreversible?
Ankita ji, you would appreciate the fact that of late, reversal of diabetes has been taking the center stage of majority discussions. Yeah. But if you look at the scientific literature, we do not see much of evidence as far as usage of insulin in giving rise to reversal of diabetes. If you look at the national and international guidelines, we have specific set of conditions where we need to use insulin at the time of diagnosis itself, like whenever the person is having very high blood sugars like fasting sugar of more than 250, after food sugar of more than 350, or HbA1c of more than 9%. If the patient is having catabolic symptoms of weight loss, if he is being subjected to surgery, or he is undergoing an stressful situation like infection. Apart from that, just to take a case of type 2 diabetes, what happens here is that once the patient is newly diagnosed, the beta cells producing insulin are under stress. So when we give non-insulin medicines, we are asking the already stressed out cells to produce more insulin. So giving insulin briefly, it gives rest to the stressed out beta cells. It prolongs the life of the beta cells. And there is one interesting South Indian study which told us that if you use insulin briefly for about a period of 4 to 6 weeks, the beta cell function is there for a prolonged period of time. There is better glucose, and patient is also under diabetes remission. So it is always a welcome step to give the patient a better outcome in the long run.
Right. All right. Thank you very much for all of that. We will have to take a quick break at this point, but sugar control, is that by itself sufficient for the effective management of diabetes? What other factors need to be controlled?
Yes, actually, see that diabetes is like a Pandora's box. It is not only about elevated blood sugars, it also gives rise to other conditions like hypertension or high blood pressure, dyslipidemia or high cholesterol levels. And the goal of management is to not only control the sugars, but also to give the patient a complication-free life. The complications have already been wonderfully alluded to by Professor Pal. But then you have to control the sugars, you have to take care of the blood pressure, you have to take care of the cholesterol, you have to keep your weight under check, because it is stated that if the weight is gaining at the cost of reducing blood sugar, probably some of the benefit that you are losing out. Apart from that, you have newer drugs in your armamentarium which not only controls the sugar but additionally controls the blood pressure, cholesterol, and gives protection to all the organs those are affected by diabetes. And very importantly, I would like to add here that all the complications highlighted by Professor Pal have to be screened periodically from the diagnosis itself so that they can be picked up early, and we have drugs to get them back to normalcy. So holistic approach and control of blood sugar, pressure, cholesterol, and ruling out complications would be the way to go forward.
Okay. Let me bring in Dr. Pal once again. Are people with diabetes more prone to other illnesses like colds and other infections?
Yes, very interesting questions. Especially we have seen that in the COVID pandemic, diabetic subjects has much more mortality. And even the H1N1 pandemic or epidemic, you can call it, of 2009, hospital admission due to cough and cold and pneumonia were triple or 4 times than usual during that period. That shows that cough and cold, respiratory problem, pneumonia, bronchopneumonia, pneumonitis are much more common in diabetes. This is because diabetes is a disease that causes immunodeficiency or immunomodulation. Both the cellular innate immunity and hormonal immunity are decreased in diabetic subjects, and they suffer from not only chest infection but also infection of the skins, infection of the genitourinary tract. Fungal infections especially are much more common in diabetic subjects, especially those who are uncontrolled. You know, some infections like abscess, carbuncle are very much prevalent in uncontrolled diabetic subjects. Not only that, diabetic subjects, when suffer from any sort of infection, they usually require much higher potency of antibiotic and in longer duration.
Right.
So, yes.
All right. Dr. Chakraborty, a quick addition to this, anything that you'd like to add to what we've already heard? Is vaccination against flu therefore a must for those with diabetes? How do they sort of try and prevent if they're going to be particularly prone to illnesses like colds?
They have to follow the typical adult immunization protocol. It's not specific for diabetes.
Okay.
As they are more prone to develop severe forms of disease, so they have to follow the immunization protocol for adults. That's applicable for all of us.
Right. Dr. Kota, quick last thoughts on this?
Yeah, absolutely. I would agree with Professor Pal and Dr. Partha. Immunization is a very important program, and now that COVID has wrecked the system, we all have to take the initiative and vaccinate all our diabetic patients with influenza. We have hepatitis B, pneumococcal, and several other vaccination program routinely.
Right. All right. We leave it at that today. Thank you all for joining us in this very informative discussion. Thanks for watching.